Today's lecture topic is about the intercostal space. The intercostal space is defined ribs, the space that lies between two ribs known as intercostal space. This space between the two adjacent ribs known as intercostal space. Because there are 12 ribs on each side, so there are 11 intercostal spaces on each side of the thoracic cage. The contents of the intercostal space, each space contains the muscles that lies in the intercostal space known as intercostal muscles. They are neurovascular bundle, the intercostal neurovascular bundle that further consists of intercostal artery, intercostal vein, and intercostal nerve, along with the lymphatics. So these structures, they are known as contents of the intercostal space. So first of all, the definition. It is the space that lies between the two ribs. And the contents of the intercostal space, it contains intercostal muscles, intercostal neurovascular bundle, and the lymphatics. So starting with the muscles of the intercostal space, there are three types of the muscles. From outside to inside, the external intercostal, internal intercostal, and the innermost intercostal muscle. So this one is the most outer intercostal muscle, the external intercostal, then the middle one, the internal intercostal muscle, and the innermost intercostal muscle. All these muscles, they are supplied by the corresponding intercostal nerves. So the nerve supply, collectively we discuss the nerve supply of the intercostal muscles, that all these muscles, they are supplied by the corresponding intercostal nerves. The action of these intercostal muscles, they are mainly the inspiratory muscles, but usually the action of these intercostal muscles depends on when the first rib is fixed by the muscles of the root of the neck, then these muscles, they act as an inspiratory muscle. They pull the ribs upward. But when the 12th rib is fixed by the muscles of the abdominal wall, like the oblique muscles, quadratus lumborum muscle, then these muscles, they depresses the ribs and act as an expiratory muscles. So actually, their action is to pull the ribs nearer to one another, either towards the upper side or in a superior direction or in inferior direction, depending on the position of the first rib or 12th rib. The first muscle, that is external intercostal muscle, that is the most superficial muscle of this group. The direction of the fibers of this muscle, these fibers run in an anterior and inferior direction. The fibers run anterior-inferiorly, means forward and in a downward direction. See in this figure. These are the fibers of the external oblique muscles, runs in an anterior and inferior direction. These fibers originates from the lower border of the rib above and inserted on the upper border of the rib below. Again, see in this figure. So this is the lower border of the rib above and inserted on the upper border of the rib below. This external intercostal muscle extends from the tubercle of the rib to the costochondral junction. This muscle, the external intercostal muscle, extends from the rib tubercle to the costochondral junction. So this space is actually deficient of the external intercostal muscle, and this space is replaced by a membrane known as anterior intercostal membrane. That is a type of the aponeurosis, also known as external intercostal membrane. The external intercostal muscles are related to its action. They are most active during the process of inspiration. So we are discussing the intercostal muscles. There are three types of the intercostal muscles: external intercostal, internal intercostal, and innermost intercostal muscles. The external intercostal muscle is the most superficial of this group. If we see the direction of the fibers, these fibers runs in an anterior-inferior direction, arises from the inferior border of the rib above and inserted on the upper border of the rib below. This muscle extends from tubercle of rib to the costochondral junction, the junction between the rib and the costal cartilage. It means this space is deficient of the external intercostal muscle, and this space then replaced by a type of aponeurosis or membrane known as, because it is present anteriorly, so known as anterior intercostal membrane, and related to the external intercostal muscle, it is also known as external intercostal membrane. Then the second muscle, known as internal intercostal muscle, which forms an intermediate layer of the intercostal muscles. Now, the direction of the fibers of this internal intercostal muscle is opposite to that of external intercostal. These fibers run in downward but posterior direction. The fibers run posterior-inferiorly. These are the fibers of the internal intercostal muscles which run in downward direction but posteriorly, posterior-inferior direction. The origin of this muscle, internal intercostal muscle, arises from the subcostal groove of the rib above and inserted again on the upper border of the rib below. Extension of internal intercostal muscle from the sternum to the angle of the rib at this level. It means the internal intercostal muscle is deficient posteriorly, and again this space is replaced by a type of aponeurosis known as posterior intercostal membrane, also known as internal intercostal membrane. This intercostal muscle, internal intercostal muscles, are more active during the process of expiration. Then the third type of the muscle, known as innermost intercostal muscle, which forms the deepest layer of the intercostal muscles, another content of the intercostal space, are similar to that of internal intercostal muscles, and usually they are considered as the parts of the internal intercostal muscles. The innermost intercostal muscles, they are separated from the internal intercostal muscles by the neurovascular bundle. It means neurovascular bundle is present between the two layers of the muscles, internal intercostal and innermost intercostal muscle. This muscle, because it is considered as a part of internal intercostal muscles, so having the same direction of the fibers and same attachment as that of the internal intercostal muscle. But this muscle is present only on the lateral part of the intercostal spaces, okay, this side. It not occupy the whole of the intercostal space, but it only present in the lateral parts of the intercostal spaces. So these are the three main muscles. In the muscular component, the contents of the intercostal space contains three muscles. The most superficial one, external intercostal, then the middle one, internal intercostal muscle, and the innermost, that is forming the deepest part or the deeper layer of the intercostal muscles. Then the second content are the neurovascular structures containing intercostal nerve, intercostal artery, and intercostal vein. This neurovascular bundle runs in the subcostal groove of the ribs and lies between the innermost intercostal muscle, that is indicated by the purple color, and the internal intercostal muscle, that is indicated by this green color. So this neurovascular bundle runs in between these two layers of the muscle, internal intercostal and innermost intercostal muscles, and runs in the subcostal groove of the rib. The arrangement of this neurovascular bundle from superior to inferior direction, the first structure, the most superior structure or top structure, is the intercostal vein, then intercostal artery, and intercostal nerve. So VAN. from superior to inferior direction are from top to bottom. The structures are arranged in the form of intercostal vein, then intercostal artery, and intercostal nerve. So some of the introduction related to the intercostal. Now all these structure we will discuss in detail with the neurovasculature of the thoracic wall. But as a content of the intercostal space, there are few points related to these structures, introductory points related to the neurovascular bundle. These intercostal nerves are actually the anterior rami of the thoracic spinal nerve. Each spinal nerve, when exits through the intervertebral foramen, then it divides into two rami. The posterior and anterior rami are ramas. The anterior rami of the thoracic spinal nerves, they are forming the intercostal nerves. These are the type of the mixed spinal nerve and supplies to the skin, muscles of the intercostal spaces, external, internal, innermost intercostal muscles. Along with it, these nerves also supplies to the parietal pleura and the parietal peritoneum. Now see in this figure, it is an example of intercostal nerve. That is an anterior rami of the thoracic spinal nerve, runs in subcostal groove with the other neurovascular structures with the new intercostal artery and intercostal vein. It gives there are multiple branches of the intercostal nerves. Gives off the rami communicans branch, which communicate the intercostal nerves with the sympathetic trunks, gives off the lateral cutaneous branch to supply the lateral aspect of the chest wall, anterior cutaneous branch to supply the anterior aspect of the chest wall, and it also gives rise the muscular branches to supply the intercostal muscles and collateral branches that also supplies to the parietal pleura and to the intercostal muscles. So these are the main branches of the intercostal nerves. But at this level, you have to remember the intercostal nerves are the anterior rami of the thoracic spinal nerves. Then the intercostal arteries. Each intercostal space contains three intercostal arteries. One posterior intercostal artery and two anterior intercostal arteries. So each intercostal space contains three intercostal arteries, one posterior and two anterior intercostal arteries. Then each artery gives off multiple branches to again supply the muscles, skin, and parietal pleura. The posterior intercostal arteries of the upper two spaces, they are arising from the costocervical trunk of that is a branch of the subclavian artery. And for the lower 9 spaces arises from the descending aorta. While the anterior intercostal arteries arises from the internal thoracic artery for the upper 6 spaces, and for the lower spaces, intercostal spaces originates from the musculophrenic artery, which is a branch of the internal thoracic artery. Again, these points we will discuss with the neurovasculature of the thoracic wall. Then the intercostal veins are corresponding to the intercostal arteries. So there are posterior intercostal veins and anterior intercostal veins. These veins lies in the deepest these are the deepest structure in the costal grooves and the subcostal groove. The posterior intercostal veins, they enter or drains into the azygous and hemiazygous venous system, while the anterior intercostal veins drains into the internal thoracic vein because they are corresponding to the intercostal arteries. So from where the intercostal arteries arises, ultimately the veins drains into their main venous channels. Then the lymphatics of the intercostal spaces. The lymph phases of the intercostal spaces follows the general route that anteriorly they drain into the anterior intercostal group of the lymph nodes, and posteriorly they drain into the posterior intercostal group of the lymph nodes. So these are the main points related to the intercostal space and their contents. A rapid revision of intercostal space. First of all, the definition, that is a space you can easily see in this figure. That is the space lies between two ribs known as intercostal space. The contents of the intercostal space, it contains muscles, neurovascular bundle and lymphatics. Muscles को further हम divide कर देते हैं three groups में या three types में. More superficial one is the external intercostal, then the middle one internal intercostal, and the innermost muscle known as the innermost intercostal muscle. In the neurovascular bundles, they are known as intercostal arteries, intercostal vein, and intercostal nerves. And the lymphatics, that lies one of the content of the intercostal spaces. जी अदिल.
मैम ये सुपीरियरली क्यों बना हुआ है न्यूरोवेस्कुलेचर
सुपीरियरली क्यों बना हुआ?
यस मैम.
इस फिगर की बात कर रहे हैं आप?
यस मैम, इसमें जो नीचे वाला है ना, जो
जी, तो
रिब के सुपीरियर है.
जी एक मिनट अदिल, सबकॉस्टल ग्रूव किस सरफेस पे होता है? ये रिब है ना?
नहीं नहीं मैम, ये नहीं, नीचे वाला.
इस फिगर में?
मैम फिगर वही है,
हाँ,
लेकिन वो
अच्छा अच्छा,
जो
एक
ग्रूव है
मिनट.
वो.
जी जी जी. अच्छा, ये जो है ना, इनकी कोलेटरल ब्रांचेस हैं. These are the main
Okay.
neurovascular bundle and these are the collateral branches. ठीक है, यहाँ पे देखिए ये लिखा हुआ है collateral branches आपकी books में भी, because these main structures they gives off multiple collateral branches. तो वो collateral branches का जो ये है ना bunch, ये यहाँ पे show रहा है. Main neurovascular bundle run करता है subcostal group में and these are the collateral branches. ठीक है जी. Any other question? Intercoastal space तो आप मेरे ख्याल से पहले भी पढ़ चुके हैं. So it's easy to remember all these things.